Today's video topic is life with a food allergy. A food allergy is when the body's immune cells react against a normally harmless substance, known as an allergen, mistaking it for a harmful one. About 3 to 4% of Europeans have a true food allergy. Food allergy symptoms include skin redness, flushing or hives, itchy eyes, a dry mouth, wheezing or shortness of breath, abdominal pain, nausea, vomiting, and diarrhea. A serious, potentially life-threatening allergic reaction is known as anaphylaxis, which can result in swelling of the airways and a severe drop in blood pressure. If you think you have a food allergy, it is important to check with your doctor. While any food can cause a reaction, 14 foods are responsible for the majority of allergic reactions in Europe. These foods include peanuts, tree nuts, egg, fish, shellfish, crustaceans and mollusks, cow's milk, soy, and wheat. When you have an allergy, you're not ill, you're only at risk of becoming ill by having an allergic reaction. To prevent reactions, it is important to avoid the food or ingredient you are allergic to. When shopping for food products, information on any potential allergens in the product will be shown on the food label. There are 2 different types of allergen labels used in Europe. The first is a mandatory label. If common allergens are part of a product's recipe, they must be listed in the ingredients list, either in bold, italic, highlighted, or underlined text. The other type of label is a precautionary label, for example, may contain. This is a voluntary label which can be applied by food manufacturers to warn consumers if an allergen isn't used as an ingredient, but there is a chance it is present due to unavoidable cross-contamination during manufacturing. Let's hear a few words from an expert about precautionary labeling.
In the prepacked foods, you see the precautionary labeling used by manufacturers with different phrases. You find may contain. You find made in a facility, where they use made on a shared line with, but essentially it only means may contain. Precautionary labeling is mainly there to warn food allergic consumers that there is a risk in consuming a certain product. Due to the widespread use of precautionary labeling, people are being confused and they're going to take risks. But there is already made some huge steps in trying to solve the precautionary labeling issues at this moment. If you have a food allergy, you might have a restriction, but you're not going to let yourself be restricted because of the food allergy. Because with some precautionary measurements and communication to your environment, you can live life to the fullest.
When preparing food, make sure you wash utensils like knives and chopping boards thoroughly in between and after use, and clean surfaces well using cleaning sprays to avoid cross-contamination. When eating out, ensure that staff are aware of your allergy and check whether allergens are visibly present in the dish or cooking preparation. Be mindful of risky situations for cross-contamination where serving utensils are shared, like buffets or ice cream parlors. All in all, if you manage your allergy well by avoiding foods or ingredients that you are allergic to, there's no need to let it hold you back from living a normal life.